Hello, my name is Rosalind Hamble, and I'm a current Sportsman 3 student. My project is on injury prevention for lateral epicondylitis, also known as tennis elbow. What is lateral epicondylitis? Lateral epicondylitis, or tennis elbow, is a condition that happens from overuse of the elbow. Athletes experience a pain on the outside part of their elbow. The injury involves microtears in the extensor carpi radius brevis. This is caused by repetitive wrist extension. Did you know that lateral epicondylitis affects up to 50% of tennis players at some point in their life? How do you get tennis elbow? You can get tennis elbow from repetitive backhands with poor technique and mechanics, and you can also get it from incorrect grip size and too tight of string tension. Some other factors may include weak forearm muscles and poor warm-up and overtraining. Symptoms and risk factors. Some symptoms are pain on the outer elbow joint, grip weakness, and pain with lifting and swinging. Risk factors: overuse and poor recovery, weak wrist and forearm muscles, and poor flexibility. Assessment. In my assessment, I looked at Ralston's elbow and compared it to the other side. I saw no significant difference between the elbows. For my next test, I used a hand diameter to compare the grip strength. In Ralston's right hand, I saw a result of 88 pounds, and in the left hand, I saw a result of 85. That's a 3.5% difference in grip strength. Finally, I looked at some videos showing proper backhand form and improper backhand form and compared it to his swing. As you can see on the bottom, on the left, you can see proper backhand form, and on the right, you can see Ralston's backhand. They are similar. You can see Ralston's follow through, which is also shown on the left. On my next slide, we'll see and talk about injury prevention and goals. Injury prevention and goals. Some goals we have is to reduce elbow stress during swinging, strengthen wrist, forearm, and shoulder muscles, improve flexibility and hand-eye coordination, and create a proper warm-up and recovery program. Warm-up. For my warm-up, we did jog in place for 60 seconds for 2 reps. And we also did arm circles and stretched our arms. Some dynamic stretches we did were wrist flexor stretch for 15 seconds, wrist extensor stretch for 15 seconds, and forearm pronation and supination for 10 reps. For my strength program, we did eccentric wrist extensor curls, 2 sets of 10. We also did wrist flexion curls, 2 sets of 10. Supination and pronation rotation, 2 sets of 10. Grip squeezes with tennis ball, 2 sets of 15. Weighted dumbbell rows for 2 sets of 10. Bicep curls for 2 sets of 10. And push-ups for 2 sets of 20. All these improve elbow strength, wrist balance, rotation control, grip strength, rotator cuff, improves bicep and forearm muscles, and improves scapula to reduce stress on elbow. Recovery is one of the most important parts in sports, and it's often overlooked. To have the best recovery, you should heat before exercise, and you should ice after with an ice massage. You should also use a foam roller and a Theragun to activate muscles. Rest is key after matches and practice so you can recover fast and play the best that you can after. Another thing that helps in recovery is proper nutrition. If you just eat a couple snacks before a game, you're going to play bad. But if you eat a balanced meal with protein and vegetables, you're going to play at your peak performance. Also, track grip strength and pain as you play. And also, adjust training load if any discomfort or pain increases, and change your rehab plan and your training. Results. Improvement. I saw improvement in form and strength in the elbow. Over the past 2 weeks, we met a total of 3 times and worked out for about an hour. To finish our program, we went to the courts and hit. I saw improvement in his backhand as a result of my program. I think if he continues to use this program and other players on our tennis team use this program, it'll help prevent lateral epicondylitis or tennis elbow. In the end, I learned a lot about lateral epicondylitis, and I look forward to the next project.